Inflammation to me is the culprit of all disease out there. If we can calm down inflammation and get that to function a lot better, pretty much almost all illnesses, especially the bigger ones in our country, could improve quite dramatically. Even prior to my Johns Hopkins education, we would see that if we have an autistic kid, there's an autoimmune parent almost every single time.
What do you say to people? They'll say, well, the reason why the numbers are more is because we're just better at diagnosing it.
That's completely false. We have.
Can you kind of break it down for us? What are the thyroid replacement hormone options out there?
Yeah, so let's say.
Dr. Josh Red, man, I told you this before we started recording, but I have to put it out in the public on the record. It's like, I can't believe it's been this long since we've connected properly. So, hey, it's long overdue, but thanks for coming on the show.
I know it's been fun to see your growth and see how far you've come. And we've kind of like paralleled each other the whole time. And I've seen you,
Yeah.
I shouldn't say parallel. I've been below you and just following
please.
suit, but
Nah.
it's awesome
No.
to see all the good work you do.
Likewise, I feel the same way. Parallel paths, because we graduated around the same time. We got into functional medicine around the same time. We're talking around 15 years, over a decade plus for both of us. So it is really cool, and it's shame on me. I should have reached out way sooner, so I apologize.
Yeah, shame on me as well, brother.
We're
it's
busy.
Awesome to get to have this opportunity, though.
Yeah, likewise. Well, let's jump into it. You have a very busy clinics, locations all over. Where are you based at, and then where are your different functional medicine centers?
So we have 8 over the Western United States. We have 5 in Utah, 1 in Boise, Idaho, 1 in Albuquerque, New Mexico, and 1 in Henderson, Nevada. And then I have regenerative medicine and stem cell clinic in Spanish Fork, Utah.
Amazing. So is that where you're
Yeah.
from? Are you from the Utah area originally?
Yeah, born and
Okay.
raised Utah. Where are you from?
I'm Pennsylvania. I'm from Pennsylvania.
Okay.
Yeah, I
Right.
did my training in Los Angeles. My wife's from LA, so we did spend time out there, but came
Okay.
back to live in the woods of
I
Pennsylvania.
love it. Oh,
Penn's
man, I love it.
Woods.
Pennsylvania is beautiful, too.
Yeah. Hey, it's
Yeah.
beautiful. It's underrated. I just need to be on the Pennsylvania Board of Tourism because I try to sell it every I feel like every episode of the
great.
podcast. What part of Utah are you from? Which area?
So I grew up in Orem. I live in a place called Mapleton, Utah. It's about 45 minutes south of Salt Lake.
Amazing. It's a beautiful, beautiful
Yeah,
part of the country.
it's beautiful. We got the mountains right out my back door. It's awesome.
Yeah. All right, let's jump into thyroid health. We've talked about it in the pod before, but it's been a while since we've talked about it, and this is going to be a fresh, deep dive in a clinical perspective on the thyroid and what people are missing, the myths and truths around thyroid. There's so much information that people don't know about thyroid health.
Yeah.
So can we set
Yeah.
the stage, I guess, first? People hear about it, but there's a lot of undiagnosed thyroid issues or subclinical thyroid. Maybe the thyroid isn't as optimal as we'd like, and it's impacting how they feel. So can you go, what are some of the telltale signs that people can have when they have an unknown thyroid issue?
Yeah, it's kind of frustrating too, right? And it's frustrating for these individuals because they go to doctor and they do these basic tests and nobody really uncovers that they actually have a thyroid issue and they're struggling. Or even if they do know they have a thyroid issue, they're not getting to the underlying mechanism driving it. And so they're still struggling, right? But common symptoms would be depression, fatigue, weight gain, hair loss, intestinal issues. A lot of them have inflammation and joint pain. I think the biggest thing, right, is a lot of our thyroid patients end up having Hashimoto's or Graves' disease, which is an autoimmune condition, and that's systemic. So these patients are suffering with severe inflammatory problems and issues, and nobody knows what in the world's going on. And even if they're on a thyroid hormone, that's great, but it's doing nothing to the underlying cause. And so these people tend to get worse and worse and worse. So like, for example, one of my first patients, back in 2010, I'm a new functional medicine practitioner. I don't think I really know what's going on. And I walk into this couple and she just starts crying right away. And she said her son was asked to draw a picture of her at school. and he drew a picture of her in bed, and he brought it home, and she's like, what's this, honey? And she's like, that's you, mom, because you're always in bed, you know?
Wow.
And
Yeah.
she had been suffering with thyroid issues for a long time. She had gone to a number of different doctors, nobody could help her. And unfortunately, they just didn't run the right labs, and she wasn't doing the right treatment, right? And so we ended up diagnosing her with Hashimoto's, and we completely changed and overhauled her lifestyle, started working on different underlying imbalances that cause it to flare up. And within probably 30 to 60 days, like she was significantly better. She felt better than she had in probably 15 years. And we didn't really do many things, right? We just made some subtle little changes, and all of a sudden this person's life has changed. But a lot of people out there are living life and have no clue because they're given a pill and they go to the doctor every 6 months and that's it. Or there's underlying factors that are driving thyroid issues and they have no idea as well.
So true. So something that we see a lot clinically,
Yeah.
and you're absolutely right. It's ubiquitous. It's around the world, and many people don't know. So I'm glad we're shedding light on this. So what are the labs that are typically ran in the conventional model to give that medication, Synthroid, levothyroxine, something like that? And what's missing with those basic labs?
Yeah, so when we prescribe thyroid hormones, from a prescription standpoint, we're really looking at TSH and free T3. That's pretty much it because we're just wanting to make sure that the patient has proper thyroid hormones. Um, However, that's just for prescriptions. And again, a lot of these individuals could have an underlying, let's say an underconversion issue of the thyroid, or they could have a protein binding problem of the thyroid, or they could have Hashimoto's or Graves' disease. And so if those aren't checked, we can prescribe hormones, a thyroid hormone, but if they're not converting thyroid hormones into active thyroid hormones, they're going to have symptoms. If the protein isn't binding properly and transporting it properly, they're going to have thyroid symptoms. If they have Hashimoto's or Graves' disease and nothing's being done to actually attack that, they're going to have a ton of not just thyroid symptoms, but systemic symptoms, right? And
Mm-hmm.
so better labs would be to do what's called like a T3 uptake. So we run a TSH for sure and T3 hormone, free T3, and then we run T4 and we run antithyroglobulin antibody, TPO antibody, and then a T3 uptake. Those are sufficient enough for me to be able to analyze what's going on. Then when those come back, I may run further tests to see if they have Graves' disease or other things on top of that, or clearly if they have symptoms of Graves' disease like heart palpitations and anxiety and restlessness and insomnia, I'll run the thyroid labs right, the Graves' disease labs right away, like a TSI antibody or whatnot.
Mm-hmm.
But classically, doctors only run a TSH. Maybe if you're lucky, they'll run like a free T3
Mm-hmm.
or
T4.
T4, right?
Yeah.
And that's it. When in
Yeah.
reality, there's probably 8 total labs that will run. And then look, like once we uncover that they have, let's say, an underlying underconversion issue, um, well, that can be an adrenal problem, blood sugar imbalance. That can be a number of other things like a, gut microbiome issue or intestinal issue to really attack the underconversion issue. If they end up having Hashimoto's or Graves' disease, we know that that's an immune issue. It's not a thyroid issue. So we
Mm-hmm.
don't treat it like a thyroid issue. Like the thyroid is just one component of a bigger, more complicated problem. And so if they end up
Mm-hmm.
having that type of problem, then we have to check all the different imbalances that are driving the actual autoimmune response, which that
Mm-hmm.
could be a whole different can of worms, right? That could be
Mm-hmm.
a detoxification problem. That can be cortisol defects. That's blood sugar issues. That's hormonal imbalances. That's intestinal issues. That's food intolerances. Then there's a whole environmental thing on top of that, right?
Yeah.
So then we do
Bi-
a deep dive based off of those labs that help us from there. So
Yeah, well said. Brilliant uncovering of the facets here. And look, when we sort of boil and reduce the full complexity of the thyroid hormone, or really, this is a kind of example of really anything in the body. These things don't happen in a vacuum. The body's interconnected. When you become so myopic and siloed to, well, just that TSH, just that T4, T3, here's that levothyroxine. What's the larger context into why we have this problem in the first place? Which you're absolutely right. A significant part of thyroid cases that we see too, it has at the very least an autoimmune component. Can you kind of distinct for people, make the distinction between autoimmunity and then inflammation? Like what's the difference between the two for people that don't know? And then just generally, what is the thyroid inflammation connection?
Yeah, that's a great question. So autoimmunity is where your immune system is attacking some form of self-tissue. So it could be attacking thyroid tissue, it could be attacking joint tissue, brain tissue, liver, intestinal tissue. It's essentially when your immune system's kind of gone a little bit over heightened and it gets confused. And then instead of attacking bad things like bacteria, a virus, or whatever that may be, it turns on itself and thinks that that's bad, right? And then antibodies will target that and lead the immune system to destroy it on a rapid pace. Now, when you have an autoimmune condition, inflammation parallels that, right? So you have what's called Th17 cells, which is an inflammatory mediator. When those cells increase, you're going to have more tissue damage and more destruction from the actual autoimmune disease too. So those can kind of parallel. Now, you can also just have inflammation in general. We have this inflammatory lifestyle. We live in America, and we're one of the most inflamed countries in the world, right? And inflammation is really good from an acute standpoint or short-term standpoint. If we have like an injury or we have an illness that it needs to get rid of. But on top of that, if we have chronic inflammation that just doesn't ever go away, that can absolutely obliterate us, right? That one, in turn, inflammation can induce food intolerances, chemical intolerances, and autoimmunity. But it can also cause like brain inflammation and a ton of other imbalances throughout the whole body. And inflammation to me is really the culprit of inflammation to me is the culprit of all disease out there. If we can calm down inflammation and get that to function a lot better, pretty much almost all illnesses, especially the bigger ones in our country, could improve quite dramatically. And so that's a common, I guess, a synopsis of those two.
Yeah, well said. A lot of people are going through fertility issues, right? We have a rise of infertility in the world today. One of, I would say it's not often talked about is the thyroid fertility connection. We know fertility is very complex. It's not just one thing. But can we talk about one spoke of the wheel potentially for many people that are struggling with fertility and the thyroid connection there?
Yeah. Here's the thing. So if they have, let's say, Hashimoto's autoimmune reaction, where their immune system is attacking their thyroid at a rapid pace, you rarely just see one autoimmune issue. We see a lot of times when they have antibodies attacking either uterine tissue or ovarian tissue. That's really common, especially when it comes to thyroid autoimmunity. But then when you have an autoimmune condition like Hashimoto's and thyroid issues, not just from that standpoint, but when you have that causes a lot of the systemic inflammation, and that will cause blood sugar imbalances. That will cause insulin resistance, that will cause insulin surges, which then cause testosterone production from the theca cells of the ovaries, which then cause infertility problems, and the whole gambit just kind of goes from there. So there is a kind of a thyroid ovarian connection. But then if you have an autoimmune issue that's thyroid related, that's causing systemic issues, which then cause a lot of problems with reproductive issues. And we see it in males and females, right? So in a male, if somebody has Hashimoto's and systemic inflammation, they can have degeneration of what's called the Leydig cells, which are the cells of the testicles. And then they don't produce testosterone properly. And then if they're female, they can have, destruction of the ovaries, which can cause a lot of different problems and issues for infertility, for sure.
We're talking a lot about fertility and how one hormonal problems impact other. something that came to mind as you were talking about these mechanisms is, and let me preface what I'm about to say, is that we can't control everything. I'm not looking to be a fearmonger or stress anybody out. This is about empowerment and curiosity about how the body works and making better decisions and starting to having agency over our health. So preface this because there's a lot of blame and shame around these topics, but I've seen studies looking at the mechanisms of Hashimoto's when the mom is pregnant and its connection to autism spectrum disorders and sort of this inflammatory component to autism. Have you seen those studies? What do you think about that sort of connection between that autoimmune inflammatory component, and I've seen it kind of connected to MTHFR, double, homozygous gene variants as well?
Yeah, that's a great question. So I have a research background at Johns Hopkins, and so research is one of my babies. I love it,
Love it.
even though it's completely flawed in a lot of different ways. But that's one of the reasons why I like it. Um, but even prior to my Johns Hopkins education, we would see that if we have an autistic kid, there's an autoimmune parent almost every single time.
Mm-hmm.
And so we saw that correlation before I even like started to really dive deep into the research and into the literature. And then I got into Johns Hopkins, and we see that so common where um, there's that correlation between autoimmunity and autism. So much so that if one of our patients who has Hashimoto's or an autoimmune disease wants to have a child, we'll tell them to hold off until we can calm down the autoimmune response and get everything to function really well and get the inflammation calmed down, which may take about 3 months or so. And then we'll tell them as we're working with them that they can try to get pregnant then, just because the correlation is so high, right? That's a
Yeah.
great question though. And I
Yeah.
don't think it's really talked about often. So
No, yeah, it doesn't. Even this whole concept, when I talk about autism statistics and the research of showing that there's inflammatory components to it for many people on the autism spectrum, and researchers are looking at, I'm just kind of, they're shooting the messenger, so to speak.
yeah,
That's not my
yeah,
research. I'm just explaining what's being looked at in
yeah,
the research world, and this connection to autoimmunity with the parents and what's happening in utero for many kids and what can happen after, where it's obviously something triggered an inflammatory response, and it's
yeah.
not one thing for everybody. That's why they call it a spectrum. It certainly is multifaceted, but when I talk about it, and then even the rate of increase of autism spectrum. Do you get this when you talk about this online where it's like because we've normalized it so much, and we talk about neurotypical and neurodivergence, they almost see it as their personality versus an inflammatory component, and their identity becomes that. And my point is, yes, we're always going to have diversity, and people are going to be different from a nervous system personality standpoint. But
Yeah,
if
yeah,
it's inflammatory, it's not a personality. If it can be reversed, it's not a personality trait. Whether
yeah.
it's autism spectrum or anxiety or depression or any neuroinflammatory problem. But it's an interesting thing, right? It's that we get a lot
It
of
is.
pushback because they feel like
Yeah.
we're demonizing, but we're not demonizing. But can you set the
No.
record straight there?
Yeah, yeah. So, I mean, you're exactly right. I think sometimes it's demonized, but when you're dealing with autism, for example, it's not a blanket approach. I mean, we know tons about autism now, and a lot of people don't realize that, but we know exactly the mechanisms, we know the problems, we know what triggers it, we know different imbalances, we know different foods that can exacerbate it, we know different environmental things that can cause it. We know that vaccines can play a role. We know that obviously there's a genetic component where the mom or dad might have an autoimmune condition. We know all that stuff. Now, just like you said, though, when it comes to that, there's a lot of different ways that we can approach it, and it's specific to that individual. That individual might have three different imbalances driving autism or autism type symptoms, whereas the next patient might have different ones. And so even for that, we have to approach it differently. But there's a ton of things that can be done if somebody is on that spectrum. There's a ton of different things that can be done to improve that child's health. And the faster you do it, the better that patient's going to improve. The brain doesn't fully develop until you're 25 years old. And so there's a ton of things that we can do where neurons are firing, things are migrating, differently. There's a ton of things that we can do from a neurological standpoint that will help. But I have a good buddy of mine, Datis Karazian.
Yeah.
He's a Harvard researcher, and he deals with a lot of autism cases. And he won't ever treat an autism case unless he treats the parents at the same time, just because he finds that the parents will have some type of autoimmune condition, or like you said, a methylation problem or an MTHFR gene mutation issue or whatever that may be. But he knows that the parents are struggling as well if the child is. So he'll basically say, okay, I'll treat your child, but at the same time, I have to treat you and your husband or whatever that may be, right?
Yeah. Yeah.
Kind of interesting. There's
Yeah.
so much that you can do, and it's a sensitive topic. But there's so much that you can do. And when you're reading the research and you're seeing the clinical differences that can be done, there's a lot of people, and it's probably a smaller voice, but there's a smaller voice, a smaller percentage that are just really loud that they're bothered by it, right? Anytime you're pushing that like clinical envelope, you're going to get a little bit of pushback. And I mean, you and I have been kind of the same, which is why we should have been friends a long time ago. Because
No.
I mean, before the pandemic, man, we had probably 40% of the country hated me because I was saying that, hey, we can improve your overall health with diet, lifestyle, and nutrition. We can improve your autoimmune condition. We can improve your thyroid condition. We can improve a ton of different things with that, right? And before the pandemic, man, we would get obliterated by people. I mean, I'd be frequented on this like Reddit page of of like medical doctors that would just bash me like crazy because I'm saying these things. And now post-COVID, that's kind of completely gone away. We haven't really gotten that much pushback from anybody. But
Yeah. Well,
as
isn't
a
that
young
funny how
clinician,
things? Yeah, isn't that funny how things work out? It's like the people that are saying the difficult truth. It's not always easy. It's not always popular, but it's like it's still the truth, whether you want to accept it or not. And a lot of people that were vilified or subjugated or deplatformed or canceled, whatever you want to call it, are now, everything that they're said, or a large part of what people were saying was true. What was called conspiracy is truth.
Yeah.
It's the upside down. Hopefully there's going to be diversity of thought and free open exchange of ideas again, and not be threatened by, people should not be threatened about differences of perspectives and ideas. We're talking about the food changes and kids and another hot button topic that irritates people, whether you talk about kids or not, adults. You talk about food changes. There's, in our culture today, there's a certain subset of people that will automatically scream diet culture, and you're going to create disordered eating. There's no such thing as bad foods. There's health at every size. What's your thoughts on that, especially if we're talking about kids and how you navigate that? Are we going to create disordered eating in our kids when we talk about healthy foods?
Yeah, it's a great question. And let's be honest. Our kids are being obliterated by inflammation. Like most of Americans' kids have inflamed brains. They have neurobehavioral type issues. Their brains aren't developing properly. They're having a lot of different problems and issues, and we're not really doing anything about it. And it stems from our inflammatory foods. And so that's one thing. And again, research is showing that if we don't improve this, then by the time they're 25, all the disorders and neurobehavioral issues they have up to that point, they have it. Like it's really hard to improve that from that point on. So you see like incarceration rates skyrocket, divorces and affairs and just kind of impulsive behavior will start to increase in adults that end up having a lot of these neurobehavioral and neurological problems from brain inflammation stem from that. But so the question though, this is a great question. I think there needs to be a lot of thought and education on how we teach kids. Like for my kids, I have 5, and we teach them kind of like how food helps them feel and how food makes them feel one way and how food makes them feel the other way. We don't really dictate what food they eat. But like for example, one of my daughters, she was I think 9 years old. Um, and we have celiac disease in my family. A bunch of my sisters have celiac disease, and so that's a problem.
Mm-hmm.
But my 8 year old at the time, I think she was 8 or 9, she started to develop anxiety. Like she didn't want to go to school. She started to have like weird anxiety that she never really had before.
Mm-hmm.
And like what in the heck is this? And it started to happen it kept going for about 2 weeks straight. And then finally I was like, hey, let's see what we can do from a dietary standpoint to help this. We checked for gluten intolerance. It came back positive. We removed gluten instantaneously. Within like 4 days, it's completely gone. Her anxiety was just completely gone. But she had a severe gluten intolerance. Now, when she eats gluten, it's not just anxiety that she has because gluten can mimic brain tissue as well. And actually, only 1 out of 8 individuals with celiac disease will have intestinal manifestations.
Yeah.
Most of them are actually neurological, which is scary because they could be eating gluten really consistently and have all these neurological problems and neurobehavioral issues, and nobody's doing anything about it. Nobody's checking, right? Because they think, no, I mean, see this a lot online too. We're like, no, that neurobehavioral issue isn't a food problem. And they're like,
Mm-hmm.
well, a lot of the research shows otherwise, right? And
Mm-hmm.
so for me personally, we removed gluten, and my daughter within a few days is back to her normal self.
Yeah.
And now she'll have intestinal manifestations when she eats gluten because she hasn't eaten it for so long. But for the first part, it was only anxiety, which is pretty crazy. And so we're just kind of helping our kids navigate. Hey, that has food dyes, and this is what food dyes does. Here's the almost exact same option that tastes just as good with no food dyes. They're like, oh,
Mm-hmm.
great. So they kind of know, like my kids probably have more education from a nutrition standpoint than maybe a lot of doctors do now because they're able to look at the back of a label, see what has food dyes, see what has artificial sweeteners or flavors or natural flavors. And it's not like they have to completely change their lifestyle and overhaul their diet. They're eating the exact same food, just not with the crap in it, right? And it
Mm-hmm.
tastes just as good. And
Mm-hmm.
so now my kids they live life to where they know what foods they eat feel great, allow them to feel good, and what foods they eat make them feel terrible.
Mm-hmm.
My little 9 year old, I kid you not, she already knows that Red 40 makes her extremely hyperactive. And we all laugh about it. Like she'll be bouncing off the walls and we're like, "What the heck did you eat?" And she's like, "I had Red 40, Dad." And she'll tell us what she ate, but it's like it is what it is. It causes problems. And there's some people that don't like that. But food definitely causes neurological behavior and problems, and it's good to be able to teach these kids, what helps them feel good and what doesn't, and how to read a
Abs-
label, for example. And it's not a calorie thing. It's not a sugar thing. It's not, a consumption thing. It's a more of a, hey, do these have inflammatory oils? Do these have, dyes, artificial dyes? Do these have high fructose corn syrup or, artificial sweeteners? And they're able to gauge and see if I eat that, this is how I feel. If I eat something better, this treats my body good. If I eat that,
Mhm.
it treats my body bad. And they live that
Mhm.
way. And it's pretty fun to see that they're kind of like they're their own adults now. Like we'll go to Disneyland, we'll go out and go on vacation, and we don't like tell them what to eat, what not to eat. They kind of navigate that for themselves. And a lot
Mhm.
of them, they do a really good job at just because they feel so much better when they eat healthier, you know?
Yeah. Absolutely. It's about empowerment and self-respect and compassion, not being perfect, but like I go back to the bigger point of like the mindset around it. It's not about restriction. And if my kid was in a relationship, if my teenager son was in a relationship with someone that was really toxic and not making him feel good, gave him anxiety, digestive problems, I'd say get out of that relationship. But somehow we normalize the food and enable something that doesn't love our kids back or love ourselves back if we're talking about ourselves here. It's like to me it's a really conversation about healthy boundaries, and we're okay with saying as a culture, oh, healthy boundaries with the relationships with other people, but we don't have healthy boundaries with food or healthy boundaries with other things, alcohol maybe, or something else that doesn't love us back. So I think it's really no different, but we've just normalized something that's so, you want to talk about disordered. It's continuing to eat
Yeah.
something that doesn't love you back and then calling it body positivity.
Well, exactly. And not only that, but when the food that we're eating is causing an opioid type reaction, I mean that's a problem, right?
Yeah.
You do a really good job at explaining all this stuff and teaching all this stuff. I think one of the things as a functional medicine practitioner is we have to be good at educating and empowering and helping these individuals understand what to do and what not to do. And
Mhm.
online, I've seen what you share this topic a lot. You do a great job at it. So I
Thank
appreciate
you.
that.
I appreciate that, man. What do you say to people that we were talking about autism? They'll say, well, the reason why the numbers are more is because we're just better at diagnosing it. It's not really, there's not more autistic people out there. It's just better diagnosis. It's always been like this. What do you say to that?
Yeah, it's completely false. We have different diagnosis tools, but autism is increasing quite dramatically. Same with autoimmunity too. In fact, those are kind of going along with each other. I bet right now we have probably 20% of the human population that has autoimmune conditions. I bet if we continue the route that we're going, we don't make significant changes, we're going to probably have 50%, and autism will continue to increase exactly like that.
Hmm.
Right now, what are they saying? Like one out of, what is it? One out of like 10 kids
50,
have,
yeah, maybe.
one
Yeah.
out of 10 kids have like a spectrum type disorder. One out of 50 have like full-blown autism.
Autism. Yeah.
And then I think one out of four kids has a neurobehavioral issue.
Yeah.
And it's only getting worse. I mean, when have we ever had where you go to like, I mean, so like for example, you go to the store and we have all these different gluten-free, peanut-free, dairy-free. We have all these free options from a dietary standpoint. You go to the school now, you have kids with significant amount of food reactions, chemical reactions, environmental reactions, neurobehavioral things. We didn't have that growing up, right?
Hmm.
This is significantly getting worse. And autism is definitely increasing. And we see that in the literature as well. Just over the last 20 years, we've had clinical tools to diagnose autism. And just in that short period of time, we're seeing it increase.
Hmm. I feel like the people that say it, they really want to die on the hill of everything's fine, nothing to see here. Like who are they working for that you want to argue for a system that's all you have to look around. The sky is blue, the grass is green. Like why are you denying reality itself?
Yeah.
Anyways, I devolve. But the
Yeah. No, no,
so
no,
yeah, go on.
you're
Yeah,
right though. You're
yeah.
right. It's absolutely bananas. And we see it more and more, like just in my friends group. We have a ton of my friends groups where they have kids that are on the spectrum. And
Hmm.
and here's the deal, there's a ton of things that can be done for those individuals to improve and have a better quality of life and be able to engage and interact and be able to function better too.
Yeah.
And so yeah.
Yeah, and look, as I said earlier, I have no doubt this humanity has always had diversity of people's personalities and who they are. I'm not saying everyone's going to be a robot and everybody's going to be quote unquote neurotypical, but it's a large part of the that spectrum has inflammatory components that can be optimized and they could be the
Yeah.
best version of them, whatever
Of
that
themselves,
is,
yeah.
and they're still going to be
Yeah.
unique. So, all right, if we could go back to the thyroid and kind of demystify the thyroid replacement hormone world, I guess, because there's so many different brand names out there and ways to support the thyroid hormone. We know not everybody needs to be on these things, but for people that
Yeah.
do, if it is a piece of their puzzle, can
Yeah.
you kind of break it down for us? What are the thyroid replacement hormone options out there?
Yeah, so let's say somebody has, and I like that you said this because there's a lot of people that think they're alternative practitioners just want to completely remove a thyroid hormone, and that's not the case. Every cell in the body needs a thyroid hormone. So let's say your thyroid has been completely destroyed by Hashimoto's for the last 20 years, and you've never been diagnosed. You've been going around to the doctor, getting thyroid hormones, and they've been seeing you every 6 months, and nothing's been done to the actual Hashimoto's, and now your Hashimoto's is like chewed up gum, completely destroyed, right? You're going to need to be on some thyroid hormone replacement, probably for the rest of your life, because your thyroid is not producing the proper thyroid hormones that your body needs, and they're really important. They help with the intestinal lining. They help with your liver. They help with your hormones. They help with your brain. If you don't have proper thyroid hormones, unfortunately, you need to be on that, for the rest of your life if you have a permanently destroyed thyroid. As far as options, this is where it gets a little bit confusing because people will ask me when we prescribe thyroid hormones, what's the best thyroid hormone that you like? And my response is whichever one your body responds to the best. Because
Mm-hmm.
we'll do levothyroxine without binders. They have a gluten intolerance. I think there's just some key things that you'll need to be concerned of, like levothyroxine and Synthroid sometimes can have binders in there that actually flare up the Hashimoto's and autoimmune response, and that can cause problems. So,
Mm-hmm.
but you can prescribe, let's say, levothyroxine that doesn't have binders, and a patient could do incredibly well with that. We could prescribe, let's say, Armour Thyroid, which has T4 and T3 in it, but it's natural, right? A lot of these thyroid hormones can be like when you're doing like an Armour, for example, it can be from like bovine thyroid. And if a patient has an autoimmune disease that's attacking thyroid issues, sometimes we'll have patients that are on Armour and actually react poorly to it. And that's the more natural one that we like as practitioners.
Mm-hmm.
And so sometimes, even though that may be more natural, patients can react to that more because of the autoimmune response. And so depending on what they do, there's a thing called Tyrosint, which is like a levothyroxine and Synthroid without the binders. It's like the healthier version without the things that can cause the autoimmune response to flare up. And that tends to be one that we really like.
Mm-hmm.
But there's some people that will have under conversion problems where they're not converting inactive T4 to T3. So to give you an idea, 93% of what our thyroid produces is an inactive T4 hormone. Your body actually has to convert that into T3, which is the active thyroid hormone, and then it can bind on to, the receptor from there. But a lot of people might not be converting that into T3 hormones properly. And
Mm-hmm.
so the mechanism driving that can be due to cortisol defects, inflammation, and the gut. And then ironically, about 60% of that conversion process takes place in the liver. So if they aren't methylizing, if their liver isn't functioning as well, they can have these underconversion problems too.
Mm-hmm.
So people that are really stressed, really inflamed, tend to have underconversion problems. If I spend, let's say, 6 months trying to work on that underconversion problem and things still aren't improving, it's still not converting, we'll add a T3 hormone to that as well.
Mm-hmm.
And that tends to really help them there. But again, a lot of our autoimmune patients, you can do all the thyroid things that you want. And if you're not addressing the actual autoimmune component, they don't improve that much. The
Mm-hmm.
thyroid hormone doesn't really do much for the symptoms. And I think that's where a lot of people are really frustrated is because they're taking these thyroid hormones and a lot of them are like, I just want to get off it. It's not doing anybody good. And that's not the safest route because at least it's minimizing, all the different problems that if you don't have thyroid hormone, it can create a lot of problems long term. But working on the underlying mechanism is going to really help you.
Mm-hmm. Well,
Here's
absolutely.
here's here's another thing too. Like this is something that's probably not talked about, but iron deficiencies is a
Mm-hmm.
big leading generator for thyroid issues. So there's a
So
ton of
true.
research that shows that iron is needed to synthesize T4 hormones. And so if you have iron deficiency, your thyroid hormones will be low. It's that simple. And then there's also a lot of research that shows that the enzyme that converts T4 inactive thyroid hormones into T3 utilizes iron. So if you're iron
Mm-hmm.
deficient, you're not going to be able to convert properly.
Yeah.
And then there's a lot of research that shows that if you have iron deficiency issues, it correlates to autoimmunity. And
Mm-hmm.
so just making sure that you have enough iron and that you're be able, let's just say this, uh, just making sure that you're not iron deficient, that you have optimal iron levels is a really important key when addressing thyroid conditions.
Yeah,
Um,
well said. You uncovered two different things that I think are really great clinical pearls and practical tips for people. One is getting the dosage right. Something that I want to call out there is and get your thoughts on it is when dosages are changed and you're saying, well, whatever, let's find out the type of thyroid replacement hormone and the dosage that works for you. Something that I find happen a lot when I see other, another doctor's managing the thyroid replacement hormone and we're dealing with all the other facets here, is they're not retesting the thyroid frequently enough, but yet they're just adjusting the dosage. So, I mean,
Yeah.
we typically, can you talk about that? Like how we like it
Yeah.
in functional
Yeah,
medicine typically?
that's a great question. We get this a lot. And I treat patients completely differently. So when you see your TSH, which is thyroid stimulating hormone, that's the marker that doctors go off of to prescribe thyroid hormones most of the time, and maybe T4. But what you'll see is your TSH is not just like stable the whole time, especially if you have an autoimmune disease. If you have an autoimmune disease, your TSH is like this. I mean, it is a roller coaster up and down. And when we check that TSH, we're just getting a snapshot in time of what that is. So we could see, oh, this person has crazy high TSH. Well, at 8 a.m. they did, but then at 2 p.m. it was clear down here, and at 6 p.m. it was up in the middle. Sometimes it looks normal. So what I do when I'm prescribing thyroid hormones, so let's say somebody doesn't have, we just diagnosed them with the Hashimoto's, they have a high TSH. I'll give them the lowest dose of thyroid hormone, and then I will recheck every 30 days. But here's another thing too. If you calm down the autoimmune response, their immune system isn't attacking the thyroid
Yeah,
as much.
more
And
stability.
then all of a sudden now the thyroid is working a lot better and producing
Hmm.
proper thyroid hormones. And so I always start with the lowest dose, but I always check the TSH every 30 days. Because if somebody has Hashimoto's and they have a flare up, it can destroy the thyroid at a rapid pace. It releases thyroid hormones into the actual blood, and it can be hyperactive. And then 2 days later, it can be back to low thyroid. And then 2 days later, it can be hyperactive again. So as you calm down the autoimmune response, it becomes a lot more stable. But you know, you have to test really frequently to make sure that you're really navigating this correctly.
Hmm.
Um, and we tend to kind of like I'm pretty obsessive compulsive about the TSH and about the
Hmm.
thyroid and about medications, and I want to make sure that it's accurate because it can cause a lot of different problems if you are overprescribed. And I also want to make sure that you have sufficient thyroid hormones as well. So doing that, I just want to make sure that I check every 30 days, and then usually after about 6 months, we get a good dosage and things are calmed down, things are functioning really well.
Hmm.
Across the board, though, when we calm down the underlying mechanisms, these patients are able to significantly drop the dosage of their medication just because
Yeah.
things are a lot more calmed down. They may not get off of their medication, but they're able to significantly drop their dosage of medication.
Yeah. Well said. Okay, and then the iron piece. Glad you brought that up. It is something you're right. It's not talked enough about, and how it's so much needed for whether it's the enzyme, like you said, the conversion, the 5' deiodinase, or the thyroid hormone itself, or the immune system, right? What iron tests do you recommend? Like a full iron panel, what would that be for people
Yeah,
that want to like ask for
yeah,
these labs? And like, do you have some optimal zones on certain biomarkers that you
yeah,
like?
yeah, yeah. So we'll do the standard like clinical ones like red blood cell, hematocrit, hemoglobin. The CBC is a really simple way to test,
Hmm.
but that's what the like conventional model tests, right? When it
Hmm.
comes to iron issues, we'll obviously do like iron saturation and iron, but the key marker that we love is ferritin.
Yeah.
Ferritin is one of those things where it gives us a lot of different takes. We can check to see if you have iron deficiency through ferritin. We can also check to see if you have inflammation due to ferritin or iron overload due to ferritin, right? Which all of those correlate with autoimmunity too. And so for ferritin, this is your iron storage. If we see, we probably see 200 to 300 patients a day across all of our clinics, and so we're testing a ton. So we kind of have like our own research center in-house, which is nice. And we're constantly doing labs, constantly testing, constantly implementing clinical research and treatments that nobody else is really treating. But we found that if somebody has ferritin under 75, they could have signs and symptoms of iron deficiency. Our optimal numbers will be to get ferritin between 75 to 125. That's kind of like
Hmm.
our money spot there.
Yeah.
But that's one way that we look at it. And so a lot of people will have like a ferritin of like 10 and everything else is normal. They're like, well, you're great. And they have all the
Mm-hmm.
symptoms of thyroid issues and
Mm-hmm.
iron deficiency problems, which actually iron deficiency and thyroid symptoms, if you look at those symptoms together, they kind of go hand in hand.
Fatigue,
Um,
hair loss.
yep.
Yeah. Yeah.
Yeah. Poor
Absolutely.
perfusion, all that stuff, right? But 75 to
Mm-hmm.
125 is a great number for us from a ferritin standpoint. And that's an easy test that you can run. If it's
Yeah.
too high, then you have to worry about inflammation or iron overload. And there's a
Yeah.
common genetic problem called hemochromatosis where
Yeah.
uh, that has an inflammatory component to it, where if you calm down inflammation, that can improve. So,
Yeah, that's a great call out too. Is that the context of ferritin, right? It can be iron deficiency, can be the opposite of hemochromatosis, or like you said, ferritin can act like an acute phase reactant. So it's spiking. It's really a sign of that inflammation that we talked about throughout this conversation, and looking at these other inflammatory markers to put context to that. It is. Ferritin needs more. Like we need to popularize ferritin more, right? Because it is such a
we
helpful clinical
yeah,
tool
it really
in so
is.
many
And it's
ways.
so
Yeah,
easy and so cheap, right?
yeah,
Like nobody realizes that if you have an iron deficiency, you can have severe anxiety. I can't tell you how many patients where like we do an iron infusion and then improve their iron levels overall, and they're like, "Oh my gosh, my anxiety is gone."
mm-hmm.
That's it. It was just an
Yeah,
iron deficiency. Like
yeah,
there's a lot of these like neurobehavioral type issues and symptoms too that could be just driven by iron, right?
yeah.
But it
Well,
makes sense. Like from a clinical standpoint, iron helps distribute oxygen throughout the whole body. If you're not getting oxygen to the brain, then you can have a ton of like depression, anxiety, a lot of different neurological type symptoms, right? So
hmm
sorry, go ahead.
well, no, I was gonna, and that's back to my earlier point of like, all right, some people just make it their personality. I'm just an anxious person. Are you just an anxious person, or do you have a long history of low iron or neuroinflammation or methylation
It's
issues?
so true. It's
Right?
so true. And you say that, it's like you teach that so well. I love it. I love it.
Yeah. My friend, I could talk to you all day. I love this sort of talking shop with you, someone that sees patients still. Let's go at the end of every episode, we have your art of being well. This is Dr. Josh Red, art of being well. At the end of every episode, we do this, just different facets of what is wellness for you. The first question is, what's the worst tasting healthy food that you eat? It tastes, you're not doing it for the taste, you're doing it for the health benefits.
Asparagus. For
Really?
some reason, I don't like asparagus. Yeah.
Man,
But I eat it. I
yeah,
eat it. I
okay,
don't
all
like
right.
it though.
Love it. The
I
next
don't like how
question
it makes
is,
my pee smell either.
no, no, that's not good. It's not good. The next question, do you take supplements? And I'm assuming that you do. Like, what are three non-negotiables for you as far as supplement support is concerned?
Yeah, yeah, I love supplements. I formulate for Just Ingredients, who you were just on
Yes,
our show recently,
I
right,
love
Carlin? So I
Caroline. Yeah.
formulate, yeah, she's amazing. I formulate supplements with her, and it's hard doing that, by the way. Like she is psychotic when it comes to making sure the supplements are clean. So I'm like having to figure out, okay, how can I get this to absorb really effectively without having like the added gums or
Yeah.
artificial garbage, and it has to be like the purest, cleanest supplement that still really works, right? Anyway, side note there. But as
I can
far as
imagine. It's a great team. It's a great team
I
between
have
the
this
two of you.
great formula. I'm like, all right, here it is. And she's like, no, it can't have this in it. It can't have this in it. I'm like, oh, I just worked on that for 6 months, and you have to go back to the drawing board and figure out how to like
Yeah.
get that supplement to be really clean and really effective. But it's really fun. She pushes me to like a whole new limit. As far as supplements though, um, non-negotiable. I think, are you saying for me or for everybody?
No, let's do for you. I want to do your art of being well. What do you take every day? Three that are just non-negotiables for you.
So mine, obviously omega threes are one. So I do a high dose of omega three. Um, I do a high dose if it's summer. Um, if it's winter, that's when I'm doing like a vitamin D3 K2 with a really good form of K2. And then I do what's called the adrenal complex, which is probably our best-selling supplement, but it has adaptogens in there, which help with the adrenal glands. And it also has phosphatidylserine in there, which helps with the brain adrenal axis to get it to communicate effectively. Those three are like I have to do every single day. Just because I live this like high stress life. I'm in a residency right now and we're constantly on the go. I'm kind of sometimes burning the candle at both ends. And the adrenal complex and the adrenal supplement helps me a ton for sure.
Love it.
So
What
if
what is
it's
yeah,
if
go ahead,
it's in the
sorry.
summer though, magnesium is
Yeah.
one of those things that I take. I mean, if I'm in the summer, I'm doing like the adrenal complex, omega 3s, and magnesium because I get a lot of vitamin D out in the sun.
What's your favorite? Do you have a specific type of magnesium that you like a form of magnesium?
Yeah, we do actually. Uh, so there's magnesium bisglycinate, which is probably the best absorbable form of magnesium on the planet. Research shows that it absorbs the best. However, there's another form of magnesium called aquamin, and it's from the Irish Sea, which is
Hmm.
interesting. But we found that aquamin even absorbs better than magnesium glycinate. It also has a
Mm.
bunch of different therapeutic benefits than magnesium bisglycinate as well. But what we do is we'll take about five different forms of magnesium at the same time.
Hmm.
And one of those is aquamin, and that tends to be absorbs really well. It helps with inflammation. It helps with the immune response. Um, it's a pretty powerful form of magnesium.
Great. What's your favorite restaurant in the world? And maybe you don't eat out, so maybe I want to know your answer. Do you eat out? If
We
so,
eat
what's your
out. We eat out
okay?
for sure.
What's your
Yeah.
what's your favorite restaurant in the world? And when you're there, what do you order?
Uh, there's a restaurant in our hometown called Soul Agave, and it's like 30 minutes away. And my wife and I drive there to eat once a week on date night, pretty much
I
once a
love it.
week. It's fantastic, but it's a Mexican restaurant, and it is really, really, really good. And they have like just real homemade corn tortillas that are they're as fresh and as clean as they can be. And we'll do the fajitas, where we have the chicken and shrimp, and their chips and salsa are fantastic. We love it.
It's a good Mexican place that does it right.
Oh,
It's a
yeah.
blessing. What town is it? Where is it at in Utah?
It's in American Fork, Utah, and they have one in Salt Lake as well. But it's the best Mexican food on the planet. I love it.
What is somewhere you haven't traveled to, but it's on your on your bucket list?
You know, we just got back from Thailand, and
Wow,
that was incredible. So that was on my bucket list, but we got back about 4 days ago, and
amazing.
it's middle of the night for me right now as I'm talking. So um, outside of that, I'd say probably like New Zealand. My wife and I, ever since we've been married, we've made traveling together like a big thing. I guess those who travel together stay together, right? So
Yeah,
we've traveled.
yeah.
We've been fortunate enough to travel the world. But I think maybe like New Zealand, Dubai would be fun. Um,
Hmm.
yeah, maybe those are my next places.
Yeah, talk to the wife. Add it to the list. The what is a book that you've read recently? It could be fiction, nonfiction. That's just I'm having this proverbial running book club list for the art of being well. What should we add to the list?
Here's the problem. So I'm right in the middle of my residency. I literally only read medical books and have for like the last 5 years. I read like spiritual books as well, right? So like with my religious beliefs and spiritual stuff, like I read, the Bible and Book of Mormon and all that stuff. But when it comes to books, I haven't had the opportunity to
Yeah.
read books, man.
I get
I
it,
mean,
man. We can't write. You can't. We're running a massive clinic in residency. What's your favorite medical textbook at the moment? Well,
right now, I'm reading a lot of like molecular biology, molecular biology medical books that are based off of stem cells. Stem cells are one of those things that is going to change all of healthcare. It's pretty incredible. At Johns Hopkins, my professor's lab, They could sever a mouse's spine and make it quadriplegic, and then inject stem cells and could fully walk again. So the
Amazing.
advancements of stem cells are just getting better and better. And even right now, like the way that we used to treat patients 2 years ago versus how we're treating them now, it's
Hmm.
improving and it's getting awesome. And so I
Hmm.
am head deep into stem cell biology books for sure.
A quick note on that. I mean, a lot of people have to go to Mexico, other places of the world to get stem cell therapies. Do you feel like it's going to be become more accessible in the
Oh, for
States?
sure. Yeah, yeah. And it's getting a lot more popular and it's a lot more regulated in the sense that we can now do these things, right? So like from an advertisement standpoint, we can advertise that we do stem cell injections for joint dysfunction and degeneration that way. So like where I'm doing my residency, we inject stem cells in the disc, and then throughout the whole spine, we do epidurals. We inject pretty much every joint in the body. It's pretty cool, and the improvements that we're getting are pretty incredible.
Amazing.
And I know it's just going to get better, every year from this
It's-
point on. So
yeah.
you have to be cautious in the States to advertise like diseases and conditions, things like that.
Hmm.
But for joints, you can advertise that. There's some
Hmm.
pretty cool things and research out there when it comes to stem cell IVs. So let's
Hmm.
say we have like an NFL player that gets concussion, and we do a stem cell IV like right after he gets the concussion. Um, they'll improve light speed, light years ahead of what they would have improved otherwise just from doing something like that. It's pretty remarkable the things that we have at our disposal, and it's just getting better. And I think that's what's cool about you, um, is that you're not like a stagnant practitioner. Like I see that you're always like growing, you're always trying to find like the new best thing to help your
Hmm.
patients. And if
Hmm.
you're going to treat a patient the same way that you were 2 years ago, like that wouldn't happen, right? Like
Yeah.
you're constantly evolving, constantly changing your way of treating patients, and I think that's what's great to see about you too. And we see
Thanks,
that
man.
with stem cells right now, where it's like we want to always stay ahead of the curve and make sure that we're pushing those limits, you know?
Yeah, well said. Thank you. I appreciate that. My friend, this has been a brilliant, amazing conversation. Where do people go to learn about your work, your clinics, the
Yeah.
supplements that you formulated with just ingredients? Tell them where to go.
Yeah, you can go to RedRiver Health and Wellness. That's our autoimmune clinic. And then we have our stem cell and regenerative medicine clinic. It's called Palma Vida Clinic, and that's in
Hmm.
Spanish Fork. And then I formulate with Just Ingredients. You can go to justingredients.us. She's incredible, by the way. I mean, her education and her background. I mean, she's a mom that had depression and was suicidal
Hmm.
actually. And the
Yeah,
only way,
we've
the
had
only
her
thing.
on the podcast. She's been a
Oh, have
guest
you?
on the
Yeah.
pod. Yeah, yeah, yeah. She's been on.
Yeah, so it's been
Yeah.
pretty fun to see her mindset and her understanding of health, where she just has kind of learned it herself. Like she knows more than
Hmm.
most doctors know. It's pretty awesome to
Yeah,
see
she
where
really
she
does.
comes from. But yeah.
Yeah. Thanks for coming on, man. Anytime.
Hey, thanks for having me.